I am Kim E, the Diabetes NP, and you are tuned into the Patient Corner. Now, the Patient Corner is a segment that I created to be a means of education for those who have diabetes or have loved ones with diabetes. Now, in my previous video, which I'll link in the description box, I gave an overview of diabetes complications. This is something that I'm going to be discussing throughout the month of March. And today we are going to dive into peripheral artery disease. So what is peripheral artery disease? It is also commonly known as PAD, and it's a very common condition that can come with diabetes. Now, it can also occur if you don't have diabetes, but since this is a diabetic channel, we're going to be talking about it in relation to diabetes. Now, really what happens with PAD, the blood vessels narrow down, and the blood flow cannot get through the blood vessels as it should be able to. Now, there are some risk factors that can put you at risk for this. Of course, diabetes. It can also come if you have high cholesterol because of the fatty deposits that can build up, that fatty buildup that can come and just sit in your blood vessels. It'll narrow that blood vessel where blood can't get through. Also, if you're a smoker, you're at risk for PAD. And then also just the natural aging process. As we age, our blood vessels, they'll narrow a little bit. They will harden a little bit. And this puts us at risk for PAD. Now, some of the common things that you may see with PAD is leg pain. You may even notice that the hair on your legs, there's not much hair there. There's a common expression that I remember hearing in nursing school that says, hair doesn't grow where blood doesn't go. So if you're having poor circulation, if the blood can't get to your limbs as it should, well, the hair is not going to grow as it should. You also may see a little bit of discoloration because, again, if the blood is not getting down there, it's not nourishing that skin. It's not nourishing those limbs, okay? And so these are some common symptoms that you may have. And one of the reasons why we really want to make sure that we get ahead of this, get out ahead of this so it will not become something more serious is because if the blood is not flowing to your limbs as it should, then that means that it's not getting nourished as it should. If things are not getting nourished as they should, then it starts to die. And what can that lead to? It can lead to amputations. We don't want to amputate toes or feet or legs. So we are really trying to prevent and reduce this risk. Now, you may be asking yourself, what can I do to prevent this? Or if you already have been diagnosed with PAD, what can I do to keep this from progressing? The number one thing that you can do is what we like to call lifestyle modifications. Now, I've made a couple of videos over lifestyle modifications. I even had an interview where I had an endocrinologist, someone who specializes in diabetes management, come on and talk about diabetes reversal as far as eating a better diet. And I'll link both of those videos in the description box so you can go reference them after this video. But the big thing that you would want to do is make sure that you're keeping your blood pressure under control, and you're also keeping your cholesterol under control. And the biggest ways, the hugest way you can do this is by diet and exercise. Getting up, getting yourself moving to help that blood flow, to encourage that blood to flow as well. Also, quitting smoking if you are smoking. That's your number one thing that you can do. The thing that you can do today are modify your lifestyle. Something else that you may have been put on if you already have PAD is aspirin or any blood thinner, maybe a stronger blood thinner than an aspirin. This is to keep the blood thinner so it can move through that narrowed blood vessel. And that's what blood thinners will do, okay? And then lastly, make sure that you're following up with your primary care physician. They may even opt to refer you to a cardiologist or maybe even a foot doctor, what is called a podiatrist, and you may even be sent to a vascular specialist. Now, these may be some words that you have heard of, but don't be alarmed if your primary care doctor wants to get you a relationship with one of these disciplines. Okay, that is PAD, Peripheral Artery Disease, in a nutshell. I hope that this quick video gave you some quick facts, things that you didn't know. And again, I am going to continue to be talking about different complications throughout the month of March. So if you like this video, make sure that you subscribe, you ding that notification bell so you do not miss an upload. I have a whole lot of content that I'm going to be rolling out that I know that you're going to love. Again, you have been sitting here with Kim E, the Diabetes MP. This is the Patient Corner, and I'll catch you on the next video. Bye.